हेलो एवरीवन। लास्ट वीडियो में हमने डिस्कस किया था फार्माकोलॉजी ऑफ डायरेटिक्स और उसमें हमने डिस्कस किया था उसकी डेफिनेशन, उसका क्लासिफिकेशन एंड वी आल्सो डिस्कस अबाउट द लूप डायरेटिक्स इन डिटेल. We discuss about their mechanism of action, their site of action. In this video, we are going to talk about the medium efficacy diuretics. We already seen its classification, and in this video, we'll discuss in detail about their mechanism of action, their site of action, and how these drugs act. Now let's start with the mechanism of action. These are the inhibitor of the sodium chloride symport, which is present in an early DCT. As we could see in this diagram also, in early DCT there are some cells present. We have enlarged these cells to understand the mechanism of action. Now where exactly these sodium chloride symports are present? These are present in an cortical segment of early DCT from the luminal site. As we could see, this is an lumen and the receptor present from the luminal side. That's why these are called as luminal receptors or the luminal transporter. Now we'll discuss about its mechanism of action. As we know, the blood is get filtered out from the glomerulus. All the constituent get filtered out except the large protein, macromolecules, and some blood proteins or the blood cells. So this filtrate also contains ions like sodium, chloride, potassium, magnesium. So our body don't want to lose all these ions because our body needs these ions to perform and normal physiological functions. So our body tries to reabsorb these ions. These can be absorbed by the different transporter, and one of the transporter is the sodium chloride symport, which is present in an early DCT. So these uptake the sodium and chloride, and then these transport to the blood and replenish the level of this constituent into the blood. Our thiazides block these receptors and increase this concentration of the sodium and chloride into the lumen, and this will be carried into the urine. So whenever the sodium and chloride and other ion are present into the lumen and goes forward, they also pull the water along with them due to the osmotic gradient which they create, and which pulls the lot of water along with them and which cause the increase in urine output. So we also seen in case of the loop diuretics which cause the hypocalcemia, but here in case of thiazide there is opposite condition. They cause hypercalcemia, and the reason is there are some special calcium transporters are present in cells of the early DCT. When these receptors are when these ion channels are get blocked by the thiazides, there is opening of the calcium channels and the calcium concentration into the blood is get increased. That's why they cause the hypercalcemia, which is opposite to the loop diuretics which cause hypocalcemia. Now we will see some of the another features of these these thiazide diuretics, like they have the additional carbonic anhydrase inhibitory action which is also exhibited by the thiazides except indapamide, and the thiazides causes more hypokalemia than the loop diuretics, and thiazides are the moderate efficacy with a low ceiling effect. Ceiling effect means whenever we increase the dose, if there is also increase in response, then we call it as a high ceiling, which we have seen in case of loop diuretics. But these are not that kind of drug. That's why these are called as low ceiling effect. That means increase in dose, but not increase in response. Then these drugs tends to reduce the glomerular filtration rate and therefore not indicated in a renal failure patient. Chlorthalidone is a longest acting drug among the thiazides, and metalazone is used in a severe renal failure. Indapamide has the no carbonic anhydrase inhibitory action. Now we'll move towards its uses and other important thing about the thiazides. So let's start with the uses. These are the first line antihypertensive drugs. They are used to mobilize the edema in a heart failure. They decreases the urine output in our diabetes insipidus, and hypercalcemia treatment can also be done because they reduce the calcium excretion. It is also used for the treatment of the calcium stones into the kidney. And moving on to the adverse drug reaction which are associated with the thiazide and thiazide like diuretics. These having the common side effect as we have seen in case of the loop diuretics, like there is an hyponatremia, hypokalemia, alkalosis, hypomagnesemia, hypocalcemia. But here hypocalcemia is not present. Here there is a hypercalcemia. That one thing we have to remember about difference between the loop and thiazide diuretics. Then again there is also increase in level of lipid, glucose and uric acid as well as calcium into the blood, which cause hyperlipidemia, hyperglycemia, hyperuricemia and hypercalcemia. So these are the some of the side effects associated with the thiazides. Apart from that, there is one important side effect, that is the erectile dysfunction. Moving on to the interaction of the thiazide and loop diuretics. So whenever these thiazide and loop diuretics are given with other drugs, what kind of effect they show? Like they show the enhanced digitalis toxicity by causing the hypokalemia and hypomagnesemia. Then loop diuretics plus aminoglycoside enhances the nephrotoxicity and ototoxicity. Then diuretics when given with lithium which cause the lithium toxicity, and these diuretics should not be given with drugs which cause torsade de pointes. Then NSAIDs plus loop diuretics decreases the diuretic activity, and probenecid plus furosemide or the thiazide decreases the diuretic activity. So this is all about the thiazide diuretics. In next video we'll see about the weak diuretics. In this also there are three subclasses that all we will discuss in a next video. Thank you.